Hello, welcome you all to my YouTube channel. In this video, I am going to discuss about my experience with COVID-19 vaccine. It has been a week since I got my first shot of COVID-19 vaccine, which was Oxford COVID vaccine. Ever since after the emergence of COVID-19, we have been waiting for a successful or an efficient vaccine for COVID-19. In India, at last, we got permission for two vaccines. It is Oxford COVID vaccine and Bharat Biotech Covaxin. Along with the country, in Kerala also we started immunization for healthcare workers. We usually will receive a message regarding our vaccination date and vaccination venue at least 2 days prior to the date of vaccination. At the time of vaccination, we need to carry our identity card. The officials in the vaccination site will verify the identity card and will give necessary instructions. The vaccination is as simple as taking a TT or tetanus toxoid vaccine in your shoulder. It is an intramuscular injection, usually like with very less pain and very few complications. I didn't experience any of the complications at the time of my injection. I have been asked to wait for 30 minutes after my injection. This is just to make sure that no serious complications are happening for those who are taking vaccine. It is very important to check for the adverse reaction since this vaccine is very new and we are giving on a large scale basis. So I've been asked to wait for 30 minutes. During this period, actually, my vitals were checked by staff nurse who are experienced in emergency management. My pulse and oxygen saturation and temperature were taken. Now, all these were recorded in respective registers. This registration is also necessary because we need to identify any serious complications at the beginning, so that we can train our medical team accordingly. Actually, I was asked to wait for 30 minutes. After 30 minutes, I've been given a few tablets of paracetamol. Usually, the complications are mild fever and mild body ache. These complications usually subside by taking a paracetamol tablet. There is no need of any expert emergency management for this kind of small fever and body pain. So I was prescribed with that medications. For me, the vaccination was very uneventful. There was not much pain, there was not much fever, no body ache and nothing. Actually, a few of my colleagues were experiencing some mild fever and mild body ache after like a day or two after their immunization. But it was, as I said to you earlier, it was usually subsides with taking 1 or 2 tablets of paracetamol a day. So in my experience, COVID vaccination is very safe, but you need to be more sure about your pre-existing disease conditions, and you need to explain all this your pre-existing comorbid conditions to the medical team at the site of your immunization. We are just beginning the vaccination with healthcare workers. We need to extend this to the frontline workers and old age people, also those who are having severe comorbidities. So it's a very big number. Gradually, after healthcare workers, we are extending this to the common public also. So my request to my fellow healthcare workers is, you should take the vaccine because you are going to fight against this coronavirus for this community. So be safe. Even after taking the injection, you are not immune to COVID. You should follow social distancing, proper use of your mask, and maintain your personal hygiene and maintain your hand hygiene, etc. All these things has to be continued even after taking a vaccine. So be safe, take your vaccine at proper times, report if you are facing any adverse effects to health authorities. Together, we can fight against coronavirus. Feel free to ask your doubts in the comment box. I will try to explain it as simple as possible. We'll meet you with another interesting video. Till then, bye, take care, thank you.